This video does not replace the instructions for use. Please always read these instructions prior to first usage. Uro-Tainer maintenance solutions are ready-to-use disposable systems for the maintenance of indwelling urethral and suprapubic catheters. They are closed and sterile solutions and should be connected directly to these types of catheters. Uro-Tainer Suby G Twin is designed for the dissolution of catheter encrustation. It includes 2 × 30 milliliters of citric acid solution. Each solution should be used one after the other. Before starting with the instructions for use, please note, Uro-Tainer product is placed in a sachet. As it is supplied sterile, it should not be removed from this overwrap until required for use. Pay particular attention to hygienic handling of the urinary catheter. If desired, bring the solution up to body temperature by immersing the wrapped sachet in warm water. Uro-Tainer can be administered independently by the patient if properly trained. A nurse or a family member could also administer the product if properly trained. The catheter rinsing with Uro-Tainer is performed by gravity alone, by maintaining the device above and below the level of the bladder respectively. The bag that contains the rinsing solution collects the liquid after rinsing of the catheter. Do not use force or agitation during Uro-Tainer Suby G Twin administration to avoid any potential trauma to the bladder. Peel open the plastic overwrap and remove Uro-Tainer Suby G Twin from the sachet. Close both tubes with the white and green clamps. Please note there is 1 clamp connected to each bag, a white one and a green one. Even if the 2 bags contain the same solution, the colors of the clamp are different. The aim is to facilitate the identification of the solution first flushed compared to the second one, to ensure the same solution is not flushed twice. Remove the tearaway closure ring. Twist and withdraw the cap without touching the sterile connector. Release the white clamp into the open position and allow a few drops of the solution to flow into the catheter to remove any airlocks. Insert the connector into the catheter funnel. Hold Uro-Tainer Suby G Twin above the level of the bladder, so the solution from the first chamber flows into the catheter. Close the open tube with the white clamp. After 5 minutes, release the white clamp and lower the bag below the level of the bladder to drain the fluid back into the first chamber bag. Close the tube with the white clamp. Now repeat the process using the second chamber of solution. Hold Uro-Tainer Suby G Twin above the level of the bladder and release the green clamp. This allows the solution to flow into the catheter. Close the open tube with the green clamp. After 5 minutes, release the green clamp and hold the bag below the level of the bladder to drain the fluid back into the second chamber bag. Close the tube with the green clamp. Ensure both clamps are now closed. Remove the connector from the catheter by turning gently. Now connect the catheter to a sterile drainage bag. Uro-Tainer Suby G Twin is for single use only. Discard Uro-Tainer Suby G Twin properly after use. Never act independently without consulting your ambulatory care service or doctor. Carefully read the instructions for use prior to the usage of Uro-Tainer Suby G Twin product.